Everyone, today's video is very special because we are going to talk about heart sound and murmur, which is very important to your exam. So let's talk about types of murmur. Basically, in murmur, we have systolic murmur, diastolic murmur, and continuous murmur. In systolic murmur, we have ejection systolic murmur, pansystolic murmur, ejection systolic murmur, pansystolic murmur, and late systolic murmur. So, what are the examples? They are aortic stenosis and pulmonary stenosis, hypertrophic obstructive cardiomyopathy, mitral regurgitation, tricuspid regurgitation, and VSD, ventricular septal defect, mitral valve, mitral valve prolapse, MVP. Next thing is diastolic. So, in diastolic murmur, there is end diastolic murmur, mid diastolic murmur. Examples are aortic regurgitation, pulmonary regurgitation. In mid-diastolic murmur, there is mitral stenosis, tricuspid regurgitation, and continuous murmur. Here we can see the continuous murmur, and the example is patent ductus arteriosus. And I think you should write down this diagram because this can be helpful as mnemonic. Like we can memorize this in this way: systolic ESM, ASPS, HOCM. PSM, MRTR, VST, LSM, MVP. So we can easily memorize this. That's why I have written this in this manner. So, and in this picture, we can see the pattern of sound. In mitral stenosis, the sound is creating like this. So, but main thing is we should remember the types of murmur and examples. These are very important for exam. So next thing, area of intensity, where we can listen the sound. See, this is the sternum, this is second intercostal, second rib, and second intercostal. This is right second intercostal space, this is left second intercostal space. So, and I have marked some areas where we can see the sounds, area of intensity. So in right second intercostal space, we hear the aortic stenosis most. We can hear aortic stenosis. In left second intercostal space, we can hear the pulmonary stenosis or pulmonary regurgitation. And in left third intercostal space, we can hear aortic regurgitation. And in left fourth intercostal space, we can hear the tricuspid regurgitation or tricuspid stenosis, or you can hear VSD, ventricular septal defect sounds, VSD sounds, and most importantly, in the mitral area, in left fifth intercostal space, we can hear mitral stenosis or mitral regurgitation. So these are the areas where we can get the sounds. So, and rule number 2, next rule is in right side, murmur increases on inspiration. In right side murmur increase on inspiration, it means if we tell the patient breathe in, and in this time we can hear the aortic stenosis louder or more clear. And the next thing is in left side murmurs increases on expiration. So during maneuver or during examination, if we tell the patient breathe out and hold, when on during expiration, these sounds like pulmonary stenosis, PSPR, AR, these left-sided murmurs sound we can hear more clear or more louder. So this is another fact. Next thing is, this is another rule: systemic murmur radiates and diastolic murmur never radiates. The systemic murmurs always radiates. Aortic stenosis, pulmonary stenosis, these mitral stenosis, these murmurs always radiates. So systolic murmurs always radiates and diastolic murmur never radiates. Another rule is systolic murmur thrills and diastolic murmur never thrills. So we can remember in these things in this way. So this is about this video. If you like this video, please like and share with your friends and do subscribe to this channel. See you in the next one. Thank you for watching.